but we've so we've definitely seen that increase in the CHINS cases, at least on the county side. And so it so far it has not been slowing down. It's actually probably increasing at a faster rate than foster care. So that's about where we're at with the county.
And you guys may be speaking at this a little bit of the program, but is program still considering sort of responses to CHINS referrals?
Yeah, we are trying to put a work group together that includes some school folks outside who aren't all usually at the program meeting too, to talk about that. It's been hard to find a time to meet, but we are working on creating that work group.
All right, thanks for that. Any questions about the routine foster care expenses and FAPT approved expenses? Comments, questions, concerns, observations? All righty. Then we have the CSA Coordinator update. Katie, you want to go first again?
Sure. We do have a few things, and I sent out an email yesterday. So we'll give an update on some of the other things and then kind of jump into that, because that's might take us a little while to kind of go through and talk about. So Jennifer and I mentioned before, we are in the process of working to recruit new private provider representatives for FAPT and the CPMT, because their terms will be up at the end of June. And so everything's ready to go live for that tomorrow. We'll send out a flyer to all of our local private providers. And then there's an application process that we use for the FAPT rep. So we hope to leave that open a couple weeks and then have time to go through those and do interviews. Last time we did the interviews, it was the CSA coordinator and then the FAPT chair. And then kind of vet those people through FAPT and bring a recommendation forward to you all. Definitely at the June meeting, maybe at the May meeting, we'll see. But definitely for the June meeting. So that's one thing that we are working on. I think, Jennifer, you had another update that you wanted to talk about.
Yep. I was just going to put out there about the FY23 CSA provider agreements. So for the county side, we normally what we've always done in the past is we've started with the county side. So the risk manager and the county attorney have reviewed those, and then they make their recommendations, and then that goes to the city for the city attorney to review. But what we've run into a little bit last year was there was some language that the risk manager wanted included in the county agreement that the city, I didn't think, ended up putting in theirs. And so at this point, what we have is some back and forth with the risk manager around some insurance requirements that he would want to see. And then the county attorney also is trying to go through the entire agreement to make some revisions to it. So she said she's about 2/3 of the way done with that, but that it's not ready yet. So my guess is the county is potentially going to have a delay in how soon they can get it to you guys for your approval, just based on how long it's going to take her to get through the rest of that document and get it back to us. So that's where we're at on the county side.
Yeah, and I think, you know, in the so typically what happens is the county kind of comes up with a draft agreement that we then share with the city attorney's office for review and approval. You know, I think depending on how quickly the county can get that done, the city CPMT, or I guess in the city, we need to make a decision about, are we going to go ahead and kind of move forward with getting the agreement approved in the city for sake of time, because, you know, it's April. The agreement takes effect July 1st and needs to be approved by CPMT. So, you know, ideally we like for it to be approved by the CPMTs in May at the very latest. So I think at some point the city may need to make a decision about, are we going to go forward with our own agreement for time's sake, while the county, because, you know, still reviews their agreement. You know, and I think we don't like doing that, because we like for our providers to be getting the same agreement for both Charlottesville and Albemarle. But you know, I am a little worried that we're kind of coming down to the wire with this process and needing to get it going.
Not only for the providers, but the work that happens once you get them, and reviewing the compliance and making sure everything's good to go by July. So
Right. I mean, I want to make sure the city attorney's office has enough time to look at it and provide any feedback, make any necessary edits and revisions that they are suggesting. And then, you know, it needs to go before you all for approval, before we can send it out to providers, and then we have to get it back. And then it has to be, they have to be entered in our system. So we just want to make sure that, you know, we're going to be able to do that before July 1st as much as possible, so we don't have providers upset with us. And, you know, we're not kind of trying to do more than we can really do.
yeah, Jennifer, has the county attorney said, like, I'm not going to be able to get through this earlier than May 15th? Have they given you some sort of like guidance of don't expect this before this day? Because that might help like inform whether or not the city can wait that long or will wait that long.
No, let's try to pull up really quick. So I'm really unclear as far as a time frame. She had just indicated that there, and again, I'm not sure what she was referring to. She just said there's a number of things that are required by law that aren't in the contract. I'm not entirely sure what she means by that, but I sent her a follow-up email, and I can follow up with her again just to see what she thinks the time frame will be. And if it is something like that Katie and I can work out so that there's enough time for the city to review it, then obviously we could bring it for the May meeting. But there is just sort of this question of if that doesn't happen, and if the city wants to go ahead and proceed, then we just may end up with two different agreements.
I was going to ask if the city CPMT feels comfortable that if we don't have something from the county, a draft by the end of April, if we could go ahead and send a draft to our city attorney's office. Of course, if time allows for it, and then we get something from the county, we can say, hey, city attorney, this is what the county's doing. But I wanted to ask if you guys would be okay with us kind of moving forward the beginning of April if we don't have something from the county.
Okay. Go ahead, Sue.
I feel like this happened last year too, and as embarrassing as it is that there's a chance that providers would get two sets of contracts with two separate languages that they needed to review. I think that that's the best option, that with the city proceed, you know, by the 1st of May with at least the draft language to the city attorney's office, in hopes that we can get it all pulled together before it needs to go out publicly. It's better than having nothing in place at all.
I would agree with that.
Same, I agree.
I mean, if anything, we could ask whoever, whichever city attorney is going to review it for us.
It's usually Allison.
So if Allison's reviewing it, maybe we can say, how long do you need to review it, and give her,
I've tried, she's usually,
give the county that deadline, as opposed to saying May 1st.
well, I usually try to give Allison a couple weeks. You know, if I get it to Allison May 1st, the May CPMT meeting, I think, is on like the 18th of May.
That's right.
You know, so that's giving Allison 2.5 weeks to get it back to me.
Makes sense. I'm for that plan. And Ashley said yes, Sue said yes. Aaron's given some thumbs ups. So I think Nita's got a thumbs up, so.
And I hate to
Do
have
that.
to do that, but and we might have to.
Okay.
So the
Now-
other, oh, sorry.
No,
Are you
I was
ready
gonna
for me to
say, and
move
now
on?
we're gonna do the risk assessment.
Yeah, fun stuff. So we sent out the risk assessments from Charlottesville and Albemarle for last year. And I didn't look over them again, but I want to say for the most part, we had the same answers. Maybe some were slightly different. And I was thinking about what's the easiest way to do this fun activity. And I think it's maybe because the instrument's the same this time around. I'm wondering if it's maybe just easiest to go through it. And if something has changed, we can change our answers. And if not, we'll keep it the same.
I like that. And can you share screen and then we'll just all,
Yes. And
read
well, how about this? I'll share my screen. Jennifer, are you able to open the one for Albemarle? And if there's a different answer than what we had for Charlottesville, can you let us know? Okay. Share screen. I have like 5,000 things open right now.
I was just saying that when this meeting was getting started, the amount of tabs that are open, it's like, where are the 17 things? Is it a PDF this time? Or is it in my web?
Right. What's
The
this
Word
thing?
document?
What's this thing called? The FY21 Charlottesville Risk Assessment. Ha. All right, are you guys seeing it?
I am.
Okay. So the first few questions are just, fill in the blank questions. So I know you guys can read. So I'm just gonna kind of give like the lead in for each of these. And again, this is what OCS uses to determine what kind of audit that we will get in the next audit cycle. So that's why we have to do this. So changes in operations, number 5.
So for the county, we actually had moderate for that one. And I think it had to do with just how many new folks we had on CPMT at that time.
Didn't we all do some crazy modifications during COVID that last 24 months?
Yeah, and so remember that we actually did this in 2020. So it would have been like right when COVID started. So just keep that in mind as well. So if you're looking at the last 2 years, definitely could take COVID into consideration.
Jennifer, I think at the bottom, I don't have it open, I closed it. But I think at the bottom, it gives reasons for why we marked moderate at the very bottom. Because I feel like it had something to do with schools or something, but I could have totally made that up. But now I have to go find it again.
For the city, I'd say slightly moderate or moderate.
I'm not. So as we do this, I remember I struggled with this last time. It's in the context of CPMT, because we lost
Oh,
40 TDT employees, right? Like right at the beginning, but in the last 2 years.
It's your
But
local CSA program.
Gotcha. Yeah. So from Region 10, I don't see a big impact. I would stick with low with CSA programming that we provide.
Is that your interpretation, Jennifer? That
Yes.
it's not just talking about your CPMT.
It's talking about your overall CSA program. So like as these things have happened, do you feel like your risk has increased? Like how would you rate it right now?
Yeah, you're rating your risk based on that statement.
We would still stay low.
And so what do folks think on the county side?
The county was moderate, Jennifer?
Yes. You know, and I would certainly, it's up to CPMT. You know, the things that I would point out are, you know, Cheryl has retired. And so now you just have one CSA coordinator. So whereas before you kind of had backup to each other, you don't really have that anymore. So I think that's some of what we could acknowledge if you all wanted to rate it either moderate or slightly moderate.
I don't think that's made a huge difference
Okay.
in our operations. I feel like we're moving right along.
So you guys want to go with low?
Am I the only one? That's fine with me. Is anyone else here from Albemarle? Nita is, right?
I'm Albemarle. I would say low.
Okay.
Mhm.
That works for me.
And then the city, you were saying, I've heard slightly moderate, moderate and low. Misty, was your moderate or slightly moderate answer related to COVID?
Yeah, for changes in operations, I think we all had to pivot and change some of the way that we operate, staffing, funding changed with the introduction of ARPA and CARES, practices and procedures. We had to create modifications. We didn't stop doing anything.
I'm seeing if it gives you a place to explain some of your answers. I don't know.
So we definitely did on ours because we did put moderate in a couple of places. And so we had put in there that the moderate ratings were based on the county schools having to make changes in operations due to the 2% cap. So it would just had to do with like kids waiting for placements or not being able to get them. And so, so we did put that clarification under number 24.
Okay, I will find a place to add that. Because that's, you know, out of our control. Okay, moving right along. Pressure to meet objectives. We marked low for the city last time.
We had moderate. And again, you know, I think part of what could be acknowledged in this is just the inability the county has suffered from in trying to find placements for some of our kids. I feel like that might be a good place to
And long
sort of
waiting lists for
note
services,
that.
any kid, from a lot of kids and parents. So.
Mhm.
And the risk of seeing them not face to face for long periods of time,
Yes.
because it's a little
Yeah.
different.
Yeah,
And it feels like the risk is higher when you're on televideo.
yes.
So how would you all feel like you would want to rate that?
I don't know.
It
But
sounds, yeah, it sounds like those are still present in the county.
yeah, no, yeah, I think we should mark it
You thinking slightly high,
moderate, maybe.
moderate?
Moderate, but I don't want to set off any bells and whistles because we went higher than
Well,
slightly moderate.
Well, so here's what I'll say is like the last time we did this back in 2020, I did moderate on some of these and we, you know, as far as I know, we're still set to do, well, I'm trying to think now. I
think we're-
guess, I think we're scheduled to do the self-assessment.
Yeah, especially if you provide an explanation, I think is helpful.
Yeah,
You know, considering how many localities are in Virginia, they only really do a handful, I think, in person. So,
and I feel like those ones that get picked are really the ones that have more of like the financial problems associated with how they're running their programs. And I feel like we always do a good job of making sure we're following policies and we're doing stuff the way we're supposed to. So, you know, I think it's okay to acknowledge that there are some like real struggles that go on in running this program. But like Katie said, I think as long as we're explaining it down below, that will help in determining which type of audit we end up with.
okay, so unless there's an objection, I'm gonna keep it low for the city. I don't hear about the wait list as much, so unless somebody
I was
else.
gonna evaluate it as low as well, Katie.
Okay. Okay, adverse publicity.
And we had low for the county too. I'm not aware of any
No,
adverse publicity.
I don't know of any.
Well, how are we feeling in the city?
It's not low in the last 24 months, no. I'd say moderate.
Uh,
Oh, I know.
I
We're
mean,
supposed to say
so
slightly moderate.
I think things that we know and things that are publicized are two different things, perhaps.
It's just, but it is specific to the media. And so we have received quite a bit of adverse media publicity.
Okay, I think that's fair. I'm just not sure that we have numbers that support the conclusion that, and so the public doesn't have trust or confidence in us anymore, or that we've suffered a decrease in trust or confidence. Our numbers are down, our length of stay is down. I think, but I could go either.
And then, of course, naturally, I was not here for the full past 24 months. But I would say it's the back end of that sentence. I think that maintaining public trust and confidence is a Charlottesville city, probably in the office I'm sitting in, issue, not so much for you all's programs, support and offerings. And so if it's really key to local programs, I am sure that yes, there is someone who has seen the upheaval in City Hall and been worried about, you know, the efficacy or the stability of a program they're in, but not in the same way as all the rest of our shenanigans. So I'm okay with either one, but just throwing in my haven't been here 24 months, haven't been here a year yet thought process, but have certainly been here for a lot of more recent controversy. I think you're still low for the programs. If it said organization, we'd have a real different conversation.
Okay. So are we okay with moving forward with it marked as low, given the perspective of we're just looking at our CSA program, not outside of that?
Sure.
Okay. Oops, service delays. We just talked about this.
Yep, so we had a moderate for the county on this one. Again, for the reasons. Well, before it had to do with the schools not being able to find the placements, but I feel like now it's just kind of been additional problems in finding placements and services. I feel like we have a lot of wait lists. So does the county want to stick with moderate on that?
This is so subjective.
Mhm.
Yes.
Sure. I mean, I could go slightly moderate to moderate. Yeah.
Okay.
Okay. Any objections to keeping it the same for the city at low? Okay. Confidentiality of data. I don't think this has been an issue to my knowledge.
Not
Okay.
too much. No.
Inaccurate data. Not an issue. Processing sophistication. I mean, if anything, I think it's had a good impact.
I was gonna say, yeah.
Okay. History of fraud,
No.
not aware of any. Experience level of the management team. Jennifer, this might have been where did you guys have a different answer? I know you had mentioned you guys had maybe had some new people on CPMT.
I think we left ours, let me get to that one. We left it at low just because we thought we had enough people that had previous experience that it kind of didn't increase the risk to the program by having newer folks. So we did leave that one low. Do you folks feel the same way?
Yeah.
I feel like we're less new.
Than a year ago, if we had done this a year ago. IT security. I feel like we're more secure now than we ever have been. Audit coverage. No, I mean, I don't think there's been any change with that. Ability to override policy. I don't see a change with that. Contingency planning.
I think that's another one of those improvements.
Mhm. Adequacy of policy and procedures. I think we've always done a really good job with that.
Yeah.
Measurable goal, objective, performance targets. This is our work plan, which is, always in process. Management review and quality assurance. I think we always do a good job with that. Training. And you guys just stop me if you feel like there's something you need to add. Segregation of duties. I don't think that's changed. Conflict of interest. That hasn't changed. Okay. So then it asks for us to describe best practices, major achievements, and or concerns. So let's start with best practices and achievements.
Can we leave some of them the same?
Sure.
I mean, I think the last bullet point remains true.
Agreed.
I mean, we could edit effective process delivery of timely services to, we effectively pivoted to assure.
And I think on the fourth bullet, we can strike the sentence about the COVID-19 crisis, just those electronic approvals are going to remain in place.
What about the increased use of kinship care? Okay, any other best practices or major achievements that aren't a part of this list? And I think for the city, at least, we'll take off the sped wraparound because like we're really not using them as much as we have, as much as we probably were back then.
Yeah, the county's in the same position, I would probably take that off of ours too.
We can certainly speak to some of the work that we are doing with our work plan.
I was gonna say, should we add increased intention and support around DEI work as a regional collaboration?
I like that idea.
Anything else?
So I was just
Alright.
going to add the only thing additional on the county side is that we continue to have a high usage of ICC on our Region 10 cases. So I'd probably leave that on there as well.
Okay, and then any concerns?
So for the county side, this is probably where I'm going to put in some language around just delays in providing services due to the variety of issues that we've run into.
No.
I mean, as far as concerns too, and I don't know, Jennifer, maybe what you just said captured that, but the lack of bed availability at residential and treat hospitalization,
Yep, I'll put that in there.
yeah, has been and continues to be really difficult. As a success, wouldn't our utilization review of mentoring be a success?
Good point, Nita. I don't know if this is a concern either, but what about in both localities, the numbers of children in care have decreased, but the average cost per youth has increased? Is that a concern, or?
Would we relate that to the increasing cost of private day schools? I mean, like, they take up a large chunk of our budget.
That would be my question. Was it because the cost of the services increased, or did the acuity increase?
And maybe they're
I
two
mean, we're
different
definitely
things.
seeing an increase of acuity in the kids that we're serving.
Mhm.
But Katie may be right, and the increased cost may be related to.
Yeah, and maybe they're two different things that could or could not be related.
Anything else?
All right. Thank you guys for going through that with us.
Thank you. And actually, sorry, I have one more thing since we were talking about that whole not being able to find beds. So one of the things that Mary sent to me that we didn't realize is there are these two report forms. One is for acute care and one is for residential treatment. And I'll be honest, I am not familiar with this form at all, but apparently local CPMTs are responsible for submitting these, which we didn't know. So on the acute care side, that would, I guess, have to do with not being able to find beds for kids that need an acute stay. On the residential treatment side, I guess it would be those like foster care cases we couldn't find placements for. And then we did have a parental placement that took a really long time to find a place. So apparently these were supposed to be done maybe quarterly or something like that. But like I said, I'm actually not familiar with these forms. I don't know if any of you guys have ever heard of this before Mary brought it to my attention. But we probably need to get something in place for how we're going to do these. Just because it's a little strange that the CPMT is responsible for like the acute care side, because I'm not sure how we would even know.
That's what I was going to say. We do have a form that we have to fill out if a child can't act, that we know of, can't access an acute care. So, I mean, we could set something in place where I'm getting that count number and share to CPMT how many times we fill out the form and send it to DBHDS. But
Yeah, and these forms go to DBHDS. So
and to be like, I heard about this in a Virginia League of Social Services meetings. And across the board, nobody knew about these forms. So this is not unique to us. So I don't even know. Yeah. So, and it sounds like Region 10 at least is doing.
Yeah, well, the CSBs, we've been doing. I think we've been required to do that for some time. We just didn't have to do them as often, you know.
Right.
So we're definitely capturing that.
Which is what these are probably, right? The same. It's probably that form because they
Well,
did
I've
it.
never done one if you can't access residential. It's just the acute care. And I don't know that we see all. I don't know that we, like if somebody is voluntary hospitalization for an acute, hospitalization and get turned down, they have to take some extra steps for us to even know. And then TDO them. I mean, most kids are hospitalized without a TDO. But when there's a TDO in place in a hospital setting cannot be found outside of the emergency room, we fill out those forms. I kind of feel like DBHDS is trying to capture something that's not capturable.
Well, to
Yeah,
top it all off, they said to make sure that we're not duplicating.
Well, so the question is, how do we have the CPMT become aware of it, right? Thanks, Mary. I wasn't aware of it either till I heard about it. I thought all we had to do was call our regional office and let them know when we had an issue like this. I didn't realize there was paperwork, but that was a rookie mistake on my part. Of course, there's two forms, not just one form, right? So wouldn't that be the mechanism that either Mary or I would be notified about it, because we have to let the state know about it, and then we could bring the form to NIDO or whoever's the appropriate person on the CPMT.
Can it be completed by the DSS if it's a DSS
Only for our kids.
case? Yeah.
Yeah.
Otherwise you wouldn't know.
Right. Like we recently had that situation, a child who was in the ER on a TDO and or an ECO for a number of days, but that was never one of our kids while she was in the ER.
Right. And that's our struggle point is, so we report it on every kid, but we don't necessarily know if it's, the pre-screeners don't necessarily know or capture whether it's a kid that's in CSA. It's not a data point. My guess is that it's captured narratively, but at this point, it has never been a data point. So that's the other struggle.
Well, for our kids, I think it's easier. We would know and we'd fill out the form as long as we remember to do so. But I see what you're saying, Nita.
Yeah. I don't know how we can be helpful on our end.
Can we just add the question to the conversation that there happens at pre-screen? That there's some connection with DSS at that point?
I have to check into that. And it's a data point I've wanted for a long time that hasn't happened. And I'm not sure why. Could be because the pre-screen is standardized and we're not allowed to change it, or, but I can revisit that and see, because it would be helpful in so many ways. frankly.
Yeah.
But I haven't gotten that pushed through yet, but I can try.
So are we saying that as long as someone from our locality is reporting out on those things, that it doesn't have to come from CPMT as well? Or do you all bring them to CPMT and we submit it twice? You all bring it to CPMT and
Pretty sure they don't want it twice.
So it says
Find
on
that.
here, what I'm reading. Persons responsible for completion of form, it is the responsibility of each CPMT and each CSB to develop local procedures for completing and submitting forms to DBHDS. CSBs and CPMTs must ensure that accurate information is submitted for each jurisdiction. If a child for whom a form is being completed is served by both the CSB and the CPMT, again, they might not be served by either, or by more than one CPMT agency, the agencies must coordinate so that only one form is submitted. There are no restrictions on which agency's staff may submit the forms. So it basically is just saying we need a procedure.
Right.
And so that our procedure could be that the CSB, submits them as they are made aware.
Or what about just adding that question perhaps to our regular monthly agenda? Were there any yous that were in this situation as a prompt that we then fill out the form and get it to the CPMT chair for submission or to the Region 10 representative for submission?
Yeah, I'm trying to find the actual form to see if it even asks for a signature or anything.
Yeah, I can't find it.
And so the acute hospitalization, like, I mean, is that only kids that are TDO'd? Or is it voluntary admissions that we wouldn't know? The other thing is, I feel like they just don't understand our system. They've already required that CSBs do it, so we do when we know. So is it okay to say, yes, Region 10 is complying with that? If you all want to review it, then, I mean, that would mean an extra step. Like I'd have to make sure emergency services tells me every single time they do one and then run the names by you all to see if they are, I mean, and that's breaking, I mean, it's starting to sound like a lot of work for me. I'm like, oh, like a lot of handwork, it's not automated.
Sounds like our procedure could be that, right? Does somebody have to approve our procedure?
I don't think so.
I mean, like, could the procedure be that you're trusting that Region 10 is compliant with the requirement that we fill that form out every time?
Well, it says that it's only if you can't get residential treatment for 30 days. So if you are able to find residential treatment at day 10 or day 25, it sounds like you don't have to fill this out.
But so when you say that's residential treatment,
Are you looking
I'm
for the other
talking
one?
about acute. That's what we track.
Yeah,
me
so
find
the
that
acute
one.
form, that one says, if you can't get it in 8 hours, you're supposed to fill this out.
Right,
And
and
it-
we do that. We comply with
So-
that hands down.
So, I mean, I think my thought would be for this acute care report form, we can just say, our procedure is that we rely on Region 10 to report all of them, and that's our procedure.
So we already have
Um,
a procedure
yes.
for this. Perfect.
Yeah. So
When
then,
you-
Do that.
residential, I have no idea how to do
so
that.
residential is a separate kind of thing because it could be a parental placement through Region 10 where they can't find a placement. It could, and I know we've ran into that here recently.
A
Or it
foster
could
care
be
case,
a foster care case. And so,
but it has to be 30 days.
30
I
days is
mean,
a long time.
yeah.
Those that go that long, we probably do at this point.
I mean, I'm not aware of any in the city that have gone 30 days without placement yet.
I just don't know, because they're somewhere, but they might be waiting for residential.
My guess is it would be at the point that you start making application for residential. 'Cause
Yeah,
at that
because
point, you know, and then if it goes 30 days past that and you still don't have one, even if the kid's in a placement, but you still haven't identified a residential, which is what you were seeking, then I think this is when you would fill this out.
it asks you to check which ones you've tried,
Hmm.
like the specific names of the residential treatment center.
We always have a spreadsheet going of those.
Yeah.
And so would I, for the parental placement, I could ask, case management to report those, or Ellen Craig to report those.
Yeah. So I guess the question is just for the residential side anyway, if it's a parental placement, then do we just like have Ellen submit the form herself? Like, does it fall directly on each? And then for foster care, it would just be the case manager or
No, I would probably have, well, I don't know. We could work that out internally. I mean,
okay.
that's if we're doing case management, that's a whole lot of different people to rely on. So I would prefer it to go through a manager or Alice, but
Okay.
just because you're talking 20 people, if you add family pres, because it might not be a foster kid. Of course, then it'd be parental placement, right? Probably.
Yeah. Okay. So, I mean, I think the main thing is just kind of bringing an awareness to, hey, did you know this form existed and we should have been doing it? Didn't know that. So I think now that there's an awareness, we can, I don't know if we need something written up as to how we're going to do this, what you guys are thinking.
It doesn't say we have to have anything in writing. It just says we have to have a procedure. Sounds like we have one.
Yeah,
Okay.
need to make sure we're doing it.
And so just for
My take.
clarity, so when we encounter that with our parental placements, we'll just submit those to DBH-DS. And does CPMT need to know?
I think our
Because-
procedure is just that you guys are doing it.
Yeah, on the form, it just says agency submitting data, CPMT or CSB. You just pick one, and then you write the name of, like you would write Region 10.
Okay. Couldn't you send me that form so I can get it to Ellen and let her know? That works.
So do
So
we
if-
have a process and procedure? That feels great. It feels great. Okay, thanks, y'all. I think we're into. Do we have any OCS communications or does that count? Nope, that doesn't count. Do we have any OCS communications?
I don't think we did.
Do we have, did I skip one? Did I skip program? No, that's next. Okay.
So program actually didn't meet. It was spring break.
Okay.
So they're gonna meet next month.
Okay. Then we have our other business, which is to review the work draft plan of the updated format and the draft equity statement and recruitment outreach action. I think, I don't know how far we're going to get, but I would imagine that the draft of the equity statement may take some time. So do you want to start with showing the work draft, the work plan draft, the new format that we have, and get some feedback from there, and then we'll check in on time.
Do you want me to share screen? Ooh,
You can or I can.
it doesn't matter. Do you have it pulled up?
Mm-hmm. Hold on now. Was it internet? What
Or-
was it?
How about I'll pull it up so that way I can go scroll through it as I'm talking about it.
No,
How
I
about
got, okay. I was gonna say, I have it if you need it, but yeah, if you want to drive, that might be easiest.
that? Yeah, let's do that.
I will say just my my first review of it, it was nice that each goal had its own page. I thought that was really nice, and I liked the incorporation of some more narrative boxes at the end so that you can track it for your reporting purposes.
Yeah, so when we talked about this a while ago, I know we talked about getting rid of some of the like 1.2-A.B3C. And so we tried to get rid of some of that and make it a little more user friendly and readable and easy to follow. And then we had also talked about making this kind of a running document so that we didn't have multiple copies, where we could kind of see what we had been doing, what progress what we had talked about last time, if we had any homework to do, those kinds of things. So I think the thought was, either Jennifer or I, during the meeting or after the meeting, we would just copy and paste from the minutes, even a little update here at the bottom for each goal. And that way too, if somebody missed a meeting and we're talking about this, they can kind of see what happened. But that was kind of our intention when we did this. A lot of the language is the same in terms of the recommendation and desired outcomes and the goals. I don't think we changed that too much from the last version. Jennifer, there anything else?
I don't think so. I mean, I think at least for me, like I find this a lot easier to follow, which is helpful. So I like this version a lot better.
Me too. I like it.
Thank you both.
This version is wonderful. I agree. And I like the little progress towards goal. That's awesome.
So is this something that we really need to incorporate into our retreat? Either making sure the form is filled out, completed. I feel like that's generally what we've done for our retreat, is to use some of that time to reflect, populate the work plan. Like you said, maybe there's some, I don't know if you need help, like copying and pasting from the minutes and that sort of thing. So it gets to its most complete form, and then we can just spend time reviewing it.
Yeah, I think so. Usually at our annual retreat meeting, we kind of update the work plan. And so maybe, just thinking about the process and how to do that. If we want to meet, at the retreat, we could talk about this and go through and make sure this is still what we want it to be, since we have been kind of tweaking this as we go along. Or if we need to add any goals or anything else. I think that's typically part of our annual meeting.
We also talked about doing a shared training. So I think in order to be efficient with our time, it'd be helpful. And if we need to like assign people some homework to be like, okay, can you update goal 1? Can you update goal 2? And sort of delegate that out, or it would just be nice to spend most of our time having an experiential activity where we're engaging in a training and doing that with some of this.
I think it's a question for the CPMT. We have talked about our work plan, probably more so in the past several months than we typically would on any other year. So maybe this is where we want or need it to be, and we can focus that time on training, but that's really up to you all. I mean, this is you all's work plan. It's you all's retreat. And I don't know if we need to talk about the timing of the retreat. I think we normally do it in like April or May. Obviously it's not happening now. And then it sounds like some folks are going to be out in May. So that's another thing that we needed to talk about as a group.
You want to stop sharing for just a second?
Mm-hmm.
Unless folks needed to see the document longer. Hey, faces. So I guess first the suggestion at our agenda planning meeting was to not have the retreat in May as we typically have done, but to push it until June because of some folks needing to be out. So is anybody opposed to saving our retreat until the June date? Okay.
Hey, I'm sorry, Misty, I'm trying to check what the June date is and I'm getting a spinning wheel on my calendar, but
Okay, the June date,
the 29th.
it would be before that. It's the 3rd.
15.
Okay, 15th. Okay. No, that's good.
I could do that.
Well, we were just going to remind folks for the May meeting, if you know that you're not going to be at that meeting, if you could please send a substitute, because we do know that there's some action items like the provider agreement, the service gap survey, and those are things that need to be voted on.
And the DSCE change. And make sure that maybe Nita and I can send out an email to the CPMT to just reiterate what our agenda is going to include in meeting quorum. So we can do that.
And remember that that's the meeting that I will be away and Ellen Craig's gonna take my place.
And any other suggestions or comments on feedback on how we should incorporate our work plan at the retreat?
I guess I feel like at the retreat, it gives us a chance to add a goal if we feel like we need to. Most of the times it's maybe just adding the strategies or taking some strategies off.
Okay.
So it doesn't have to be the whole time, but it does help it to live when we just sort of edit it at least annually to stay relevant.
Perfect. All right. At this time, I feel like we would be rushed to try to get through a conversation on the equity statement. I feel like that needs some more time than what we have left. And so we can talk about the recruitment outreach action update or skip to agency updates from CPMT members. The recruitment piece, it was just to continue that conversation about any specific strategies that we wanted to take as CPMT members to help recruit for our provider and parent reps.
I think we were also, when we do the private provider, we had talked about doing something with the parent rep. Not sure if there is like a flyer that Jennifer and I need, or an email communication or something, maybe Jennifer and I can work on putting together. But just while we were looking at one, I think we had talked about trying to work on the other two.
Were we gonna vote? We were gonna vote, I think, on changing the policy, right? That the parent wasn't able to be in the child serving role. Is that a conversation we had?
So that's actually a policy that went forward to the SEC.
Okay.
So I'm not sure if that's actually been passed. I
Gonna change, yeah.
feel like it has, but I'm not 100%, so I can go back and check on that one. If that has, my guess is it's going to make it a lot easier to fill that parent role. It just may not be filled with the ideal person that we're sort of wanting to have from that parent perspective. But it does mean that we meet the code requirement, which is what will be important during an audit, is that you know, by code have to have this position filled.
Are there any arenas in which organizations or support groups or community partners that may interact with parents that we could like connect with to share a flyer or share the opportunity, like giving the link to the actual application on the websites?
I think that's, last time we talked about this, we came up with some ideas, but I do think it would be helpful if we kind of have a script, so to speak, that we can kind of send out as we identify these groups, with the contact name and all of that, because that could also be like forwarded to somebody else, and all that. So that's why I was just thinking maybe, we have a pretty structured process in place for our private provider recruitment, and we have a flyer and direct them to the website and it has all our contact information on it. And so, I was just thinking, why don't we have something similar that kind of maybe also explains a little bit about what the role is and all of that, as a place to kind of start.
The creating flyer,
sorry.
I would say schools is our place, like prep, it hits all the parents. If we had a flyer as Katie described and sent it to Charlottesville City Schools or Albemarle County.
Yeah.
Schools.
And Katie, I'll get with you because it's been enough years that I can't actually remember what all I put together. But when we were trying to get a parent rep for us, I had reached out to Kevin. He went to like the parent group at the school or whatever, and I feel like maybe I had a flyer that he was able to use for that. So I'll share that with you. And I also went to like our local NAMI group or like to try to reach folks there, which we did actually have some folks interested until they realized what CPMT was, and that actually wasn't what they were looking for. So I think making sure that we put in the flyer like what this really involves. Most of those folks were looking for more like direct involvement with families, which is not what this is. So.
Right.
So in the meantime, would you we'll maybe look at the flyer that Jennifer, if she can find that as like a template starting place, and then we can sort of go from there. But I agree with you, Katie. I think that's a great idea to have our sort of talking points and how we want to frame the position and its role. And maybe that's something that we can also talk about because it's part of our work plan and to do that better. So we can also talk about it, like work on sort of a template and then get it to a more final form at the June retreat. All righty. So I think all we have left is to share any celebrations or announcements or updates from agencies or CPMT members. I will say that community attentions, community-based services, or the internship program and the Teens Give service learning program are going back in person, pretty fully operational this summer. So if folks are interested in sharing that information, right now there's scholarship for city residents to participate in CAIP's the internship program, but there are not scholarships for county residents. So it would have to be part of the CSA system and get FAPT funding for county residents.
I'll just say, I'm not speaking for all of the city staff, but I'll say about the time the city offices are considering opening to the public, our department is getting all of its walls painted and carpet replaced, which is going to be very disruptive because the staff has to pack up everything in their office and we have to store it somewhere else in the building. We can't have any access to the workspace, and it will likely prolong the period of time until we have regular public access for our department. But we're still working out the details, and once we learn more about the timeline for the work, we'll get out a message to the public. It's going to be great.
Good luck. Any others?
We, from the health department standpoint, are slowly working to, as we continue to build services back up, but are looking throughout April, May, June, and then ramping it up like in July and August for back to school immunizations for children to try to accommodate. So there are things on our website, there are flyers that have gone out to all the schools. So it's a slow process, but we're trying to at least meet some expectations.
Nice. You're muted, Lisa.
What is the health department trying to do for the children?
We are working to have more availability for back to school immunizations. So we are
Okay.
looking at
Okay.
offering more services and trying to also offer something that are off hours so people can come and not always disrupt people during work. So, you know, that's always trial and error trying to figure that out. And a lot of people like to come right at the end, but we're working on it.
All right. Well, I hope you all stay healthy, safe, enjoying the warm up that's coming to us later this week. Thank goodness. Thank you all. We'll see you next time.